Hello, my name is Emily Vang, and I am going to talk about preventing hospitalizations in home care patients by improving care team communication. So, first, we're going to talk a little bit about Home Care 101. Home care agencies provide services to patients in the comfort of their own homes. The possible disciplines that are included are home health aide, homemakers, personal care assistants, nurses, medical social workers, physical, occupational, or speech therapists as well. One of the biggest indicators of positive patient outcomes in home care is preventing rehospitalization of the patient once they have been discharged home. Each year in the United States, there are more than 3 million homebound patients who are in need of CMS or Centers for Medicare and Medicaid Services paid home care services. Of these 3 million patients, at least 1 in 4 or a quarter of them will be rehospitalized within the same year. Data collection regarding patient outcomes is completed in home care via CMS, and it is called the Outcome and Information Set, or OASIS protocol and data set. Home care agencies can be very busy. Some days people can be seeing 7, 8, 9 patients in a day. Due to this, sometimes calls will be missed, texts will be missed. There might be a delayed response to emails or voicemails. And priorities might change based upon what's going on when you go visit the patient. If you have a patient that's fallen on the ground, you're probably going to want to address that prior to checking your voicemail. And every agency has a different protocol, procedure, and a different EHR system in place. So, what is the problem? The problem is that there is an ineffective or delayed communication amongst the care team, and this leads to rehospitalization of home care patients. But this could be prevented if communication had taken place a bit sooner and been a bit more effective. So, how do we recognize early risk factors and prevent rehospitalization in home care patients? The answer is to improve communication within the care team and then implement those preventative interventions early and often. So, how do we do that? So, before I talk about how we do that, I'm going to give you a little example and a scenario. So, let's say we are at a home care agency and we have Nurse Jackie and Jay and physical therapist Pete or PT Pete, and they both work at the same home care agency. This home care company policy requires same day care team communication, which means that if there is an issue or a concern, members of the care team are required to communicate their concerns to the case manager within 24 hours. Communication is allowed to be via phone call or email. Clinicians are not required to check or respond to emails, phone calls, or voicemails on their off hours. So in this case, working hours for this agency are from 8 a.m. until 5 p.m. There's also an on-call system in place. However, this on-call system is reliant on patient self-report and patients to call. So here's the PT perspective. During PT Pete's initial evaluation visit at 3 o'clock in the afternoon, he notices that patient Z shows a decline in their functional scores. And this is since their admission visit, which was less than 24 hours ago. So Pete calls Nurse Jackie, who's the current patient case manager, to alert her of his concerns, but he only gets her voicemail. He does leave her a message, and then he also sends her an email for good measure. Here is Jackie's perspective. Nurse Jackie has a busy day and is scheduled to see 7 patients during her 8-hour shift. She's scheduled to perform an admission visit at 3 o'clock in the afternoon, and just as she is beginning her in-depth assessment with her new patient, her phone rings. She ignores the call and continues with her assessment. She completes the assessment and the visit, and at about 4:45, she proceeds to her vehicle to go home for the evening. She gets wrapped up in her evening responsibilities as a mother of 3, and she doesn't remember that missed call from earlier in the day, nor does she check her emails after 5 o'clock, which is per agency policy. When Nurse Jackie returns to work at 8 o'clock the following morning, she sees the email from PT Pete and immediately remembers that missed call. She listens to that voicemail and then proceeds to call patient Z to schedule a visit as soon as possible so she can reassess him. She is informed that patient Z was sent to the hospital late last night via ambulance due to shortness of breath and was admitted to the hospital at 4 o'clock in the morning for fluid overload. So let's discuss this. This scenario illustrates a very possible challenge in home care communication. Both of the clinicians in this example followed company protocol, but it did result in delayed transfer of pertinent patient information. And it could have prevented hospitalization of the patient if this communication had been done quickly and interventions had been implemented in a timely fashion. So, how can we prevent delayed communication and improve patient outcomes in home care? One possible solution would be that communication in home care should include access to all of the patient documents, links, notes, and information. So, in a lot of cases currently in home care, clinicians need to look at various different areas for patient information. This increases the risk that they might miss some pertinent information because they have to look in so many places. There was a way to centralize this information and make it easily accessible for all clinicians. It could increase communication and prevent problems in the future due to misinformation. Due to the infrastructure of current home care EHR systems, it is challenging to easily obtain all of that patient information, as I had discussed earlier. Home care agencies can make care team communication more efficient by using an integrated software platform with communication options built in. So currently, not all EHR systems have a thorough communication system built in that facilitates different parts of the care team, different members of the care team to discuss the patient. By creating a new system wherein we could easily facilitate this communication, we could prevent rehospitalization in patients and improve patient outcomes. So here's the vision and the idea. To properly address current home care rehospitalization rates and care team communication challenges, there's a need for a software or an EHR system with a built-in user-friendly interface that facilitates timely communication amongst the care team. This alert system would have a built-in triage alert system that would facilitate timely review and intervention implementation if appropriate. So we would have that prioritization, but we would also have a smart alert system or a SAS. So SAS is the idea wherein, if it was ever created, that it would be able to scan patient data in the chart and generate urgent alerts to help prevent rehospitalization based on predetermined parameters that could be customized within each facility and agency. So the system ideally would be built into an EHR as an add-on functionality. You could do this via a partnership with an existing EHR or build an entirely new EHR and then go into the market with that. SaaS abilities would be to scan the medical record and generate alerts. These alerts would follow a customizable triage format to facilitate timely intervention. All of the functionality of the SaaS would be highly customizable to make sure the correct alerts go to the correct team members and to ensure patient data is successfully protected. So there are a few SaaS limitations, one of which is that computer systems are very complex and they require significant coding and software engineering to function properly. If you look at medical records, there are a mix of fill in the blank, predetermined answers that you get from drop-down boxes, free text areas, links to external documentation, billing functionality, report generators, scheduling, coordination, internal planning notes, and sometimes even photos and imaging. Due to this large variability of content, it could be very difficult to navigate and review and create a system that's able to scan the EHR. Knowing this system, the SaaS system, would be limited in its ability to scan data. And it would be limited to only include data from like pre-selected drop-down sections or simple numeric entries like a blood glucose or blood pressure. So I mean, all it means is that it's limited in what it can scan. However, if the correct coding is in place and the correct algorithms are in place, it will still easily be able to generate alerts to notify the care team and prevent rehospitalizations in home care clients. So implementation of this product would first require it to be built, tested, and then sold to consumers. I did get to talk to a software developer about this idea, and he told me that it's totally feasible and simply requires access to EHR data. So that was promising. So assuming we could accomplish that and get that access to that data, implementation of this software would be challenging, no matter what. And successful implementation includes creating a solid foundation for that transition, which would include your project management, your expectations to your team, your administrative team, and the rollout of this new functionality and this new EHR and this new software. Successful end user education, and then also allowing feedback opportunities. So Farina had a great quote stating that clinician participation during an implementation is critical to achieving higher adoption rates and evolving the organization for a successful future. Clinicians bring a unique perspective to the table during an EHR implementation, and involving them early and regularly will positively influence attitudes towards the project, which is awesome. And I totally agree. You have the end users out there, they're using the software, they're trying these new policies and procedures, and they're able to give really great feedback about what's working and what's not. And if that administrative team is able to take that information and utilize it to change their current policies and procedures to make them more effective, everybody benefits in the end, and patient outcomes also improve. So once we would implement this, we'd have to monitor it for successful outcomes. So once SAS is implemented, ideally we would measure the success via data comparison from EHR hospitalization rate data prior to implementation of SAS, and then also following implementation of SAS. And then what we would do is we would compare it. And my hypothesis would be that once SAS was implemented, rehospitalization rates in home care patients was reduced, and care team communication was improved. So the ultimate conclusion is that there are various opportunities for improvement in home healthcare team communication. I am so excited for the future of health informatics and the possibilities of it and how it can improve patient outcomes both in inpatient settings and outpatient settings and home care settings. Here are my references, and thank you again for your time.